Hello and welcome to the Cancer Patient podcast for Queen Elizabeth Hospital. So I'm here today at the Proto building and I'm really pleased to have some expertise in the dietitian field with Emma Atkinson. Emma Atkinson is a registered dietitian which has been registered now for 17 years and worked at the Queen Elizabeth since 2009 as a Macmillan Dietitian. She's really passionate about her role and has a really strong interest in oncology. She's worked with a range of different tumour sites and at various stages across the cancer journey. So thank you so much, Emma, for coming today. Today we're just going to talk a little bit more about nutrition during cancer treatments, and Emma's going to explain, what exactly does the oncology dietitian do during cancer treatments.
So oncology dietitians work with patients right across the cancer journey. So we can become involved in a patient's care either at the time of diagnosis, before treatment commences. Often we can become involved during treatment or even after the treatment is completed. We can work with patients who have both a curative treatment intent, but also a big part of our work is working with patients who may be having palliative care and maybe for best supportive care. So it's quite a varied role. My role in particular can include all cancer sites, so it's quite varied, although some centres in the northeast can be specific to certain tumour sites. It involves providing very much individualised care to patients, so often patients will have totally different dietetic needs and nutritional needs, so it's about working with patients to identify what their nutritional needs are and how we can best address those needs. And I think a really important aspect of an oncology dietitian's role is about providing support to patients, because it's not just about the actual advice that we give, it's about giving the emotional and the holistic support to patients. And I think that's really important to consider relatives as well. It's not just about the patient. Obviously they're the main focus of our input, but often, and in my role in particular, it's about supporting family, because they can often have anxieties and worries relating to food and nutrition for their loved ones. So it's about working with the family as a whole.
Because I think that's the hard thing, especially with things, we're at an era now where the information, once upon a time, maybe 20 years ago, the information just wasn't out there for nutrition. But now we've gone from sort of not really that much to, just tapping something into the internet and getting all that information. But the difference is that sometimes that information isn't always the correct information. Do you see a lot of that now, about a lot of myths about what you can and can't eat?
Definitely. I think you have to be so careful, because as you say, I think as the years have progressed, the internet is becoming such a big part of people's lives, and I think people, out of trying to do the right thing, try and look up information about cancer and treatments, and it's understandable, they want to do the right thing, they want to take control of the disease, but I think a lot of the information that sometimes comes up online can be totally wrong. It might not be factually correct. There's a lot of myths about nutrition and cancer that aren't necessarily evidence-based, so I would always check the sources that you're looking at, and if there's any doubt at all, speaking with a health professional or in particular dietitian, to try and decipher which is myth and which is fact and which information is safe to follow.
I think a lot as well people have got to bear in mind is a lot of these things are sponsored. So a lot of these trials and things like that, there's money to be had to promote something. And that's, again, I'm glad you've reinforced that, look at the source of where it comes from. And I suppose that's the great thing about you working with Macmillan. They're a great source. We've got some great online features on their website, specifics about, nutrition and fatigue and treatment. But, why do you think, nutrition is so important during cancer treatments, Emma?
I think that the needs of patients during cancer treatment can massively vary. So I think for most of the patients that I in particular would see, patients may find that their appetite is reduced, or they may find that they're not able to eat the same types of food that they might have eaten previously. They may have lost weight unintentionally, so they may be either at risk of becoming malnourished, or they may already have lost a severe or significant amount of weight and be malnourished. And for those patients, I think it's really important to try and optimise oral intake during treatment and prevent further weight loss, just because we know that malnutrition can affect treatment response in a negative way, and to prevent the adverse effects of malnutrition, so impact negatively on quality of life, on energy levels, risk of infection and things like that. But then equally, I think there's a lot of patients who might have treatment who might actually have a great appetite, they might not have lost any weight, and actually for them they might have gained weight with the treatment. And I think for them it's a different level of advice that they would need, because they may be looking at more healthy eating advice to prevent further weight gain. And I think generally when patients are having treatment, I think nutrition is a way of regaining some control back in their lives, and I think it can be a way of promoting energy levels and sense of well-being. And I think it's just establishing what is needed for that particular person, whether that is healthy eating advice or what we would call like high calorie nutritional advice. So it's looking at the individual patient to establish what they specifically need.
So I think, you know, if we discuss somebody who's maybe going through chemotherapy, that environment that they're living in isn't the best place to be, you know, so you look for things that do make you happy, you know, and often food is one of those things that make you happy. So it's difficult if maybe somebody's starting out on chemotherapy and maybe the BMI's high, you know, and we understand the consequences of that. And sometimes we know with some chemotherapies, I know with breast cancer chemotherapies, often ladies come out of it a lot heavier. There may be some other cancer treatments. What would your advice to be with somebody who is maybe, you know, overweight when they start chemotherapy? Obviously, you know, you wouldn't want to minimise your calorie intake, but just kind of keep it on a plateau. You know, would you advise something like that?
I think it's getting, like you say, a balance, because I think if you're already starting with a high BMI, and I think the important thing is that often people with a high BMI, they may still lose weight and become at risk of malnutrition, but if that's not an issue, and if you're eating well during treatment, and if you're actually, like you say, gaining weight, I think my advice would be it's about getting the right balance. So it's about eating adequately, you know, and maintaining a good appetite, but getting that balance of not necessarily gaining too much weight. And that's where I think it can be difficult, because I think it is fine-tuning it and getting a balance.
Yeah, it's, you know, and it's like I say, when you're on the internet and reading these things, and, you know, there's other factors other than the scales, you know, because again, there's like water retention, you know, obviously the use of steroids can contribute to weight gain. So I think probably your advice would be to be mindful, but it's not.
Yeah, I think even maintaining your weight during treatment, because I think you have so many other things going on that I think trying to lose weight would be an extra thing added on. So I think often the best approach is to try and just, you know, maintain your appetite and your weight during the treatment, and then possibly after treatment, you know, if it's appropriate then and you wanted to look at your weight, that may be a better, like more appropriate time to do it.
Why do you think patients find it so difficult to achieve good nutrition during treatments?
I think there's so many side effects from the treatment, like you mentioned, chemotherapy. So patients often get nausea, vomiting, they can get taste changes, which totally affects their enjoyment of food. They don't enjoy the food in the same way. They can get, often patients who have other treatments, like radiotherapy for example, they can get swallowing difficulties or sore mouth. You can get bowel changes. So I think you've got lots of side effects that actually impact on the way that we eat and enjoy food. And I think another side effect I would say is fatigue, but also I think when patients have a lot of appointments to go to, they have a lot, even just mentally, a lot of things on their mind. I think fatigue becomes a really big problem, and then I think you have a problem then about having the energy to go out and buy food, especially with you know, the restrictions with coronavirus at the minute. That impacts on that as well. So I think it's having the energy to go out and buy the food, but then also to stand and make the food, because I think if you've been at treatment all day or you've had a lot of appointments and you come in, maybe the last thing you want to do is actually stand and make food, or haven't even the time to plan and prepare what you want to make. And I think a really big thing is knowing what to eat, because I think, like you say, it can be so confusing about what we should be eating and what information is correct on the internet. And I think especially when patients have it pre-existing health conditions, so diabetes or heart disease, that makes an even bigger minefield, because suddenly you're trying to maybe balance the eating with any other pre-existing conditions as well, which makes it even harder.
What would you sort of advise for it to be your go-to foods for things like fatigue? If somebody, again, if patients are on steroids, they're on chemotherapy, they're worrying about the future, they're worrying about finance, obviously then that disrupts the sleep. So, they're not only just fatigued from the chemotherapy itself, but fatigued from not getting sleep. That often has an effect on your willpower to kind of stray from foods that we know that we shouldn't eat, because you just want that instant, like you say, energy, don't you? So what would you advise for fatigue and food sources for that?
I would say, make the most of days where you might be less fatigued. So maybe try and plan ahead. And if, there's particular days in the week where you're not as tired, maybe doing the shopping on those days, trying online shopping. I think not being scared to ask for help, for other family members to help with things like shopping and cooking. I think making foods in advance can be really helpful, because you can make things in a batch, obviously being really mindful and careful about reheating foods with chemotherapy, but trying to make things ahead. I think not being too scared to make, if you are particularly tired, having some healthy ready meals in the freezer if you are eating healthy that you can go to, and easy meals that are really quick and easy to make. It doesn't have to be a recipe that's quite complicated or from scratch. It's okay to have things that are easy and nourishing.
I think even something like baked beans on whole grain toast, something like that, where, and again, it's a cost as well. People are we're in an era at the minute where people are losing jobs, or the pay has been maybe cut to half, and it doesn't always have to be the most expensive and, like you say, the most complex meals. And I think for people who are maybe undergoing bowel cancer or breast cancer or any kind of cancer surgery, where maybe they're waiting around for a couple of weeks for treatment to actually start, bloods and tests are being done, would you say this is the time where, do your batch cooking, get it in the freezer, and, write a note on it so you know exactly what it is, and these are you've kind of got a week's worth or, a month's worth of different meals there to access.
Definitely, because I think, you can buy store cupboard foods, like you say, you can get things in your freezer, always just making sure that when you do defrost it, you do it safely and you reheat it safely for infection risk, and follow guidance for that. But I think definitely planning ahead and buying in the foods that you've got, so you've got them there in advance, would definitely be like a great idea.
And things like, there's a lot of things about the best form for your food to be eaten in, it's difficult to buy fresh fruit, like I say, if you're not being able to go out shopping and get fresh fruit and fresh vegetables. Is there still a role for like frozen vegetables and tinned fruit and things like that? Are they still getting the same sort of nutrients from them?
Definitely, and I think what I would say is, in terms of that, like the frozen vegetables are brilliant, frozen fruit that you can keep on stock and you can use those. Canned fruit and veg, just making sure that if you're getting fruit, that it's in a natural juice rather than a syrup, particularly if you're diabetic. And I think another good tip is, often if you've got lots of vegetables, you might buy vegetables and have lots in the freezer, using that to make something that you could then freeze. So for example, like if you've got lots of vegetables, you could cook them down and add them to some tin tomatoes or passata and make a tomato sauce that you could freeze, that you could use that on, like if you were making homemade pizzas, you could use it as a pizza topping, you can use it as a pasta sauce, you can use it for a basis for casseroles, and you can keep that as healthy as you want. Or if you do need the extra calories, you can fortify that up. Often dietitians will advise on that, so you can make things as high calorie or as low calorie as they need to be as well.
That's a great idea, isn't it? And like I say, from a cost point of view, it's really good. And waste as well, because we do waste a lot of fresh fruit and vegetables. So you hear a lot of, we've talked about, using things like Dr. Google, and there's a lot of stuff out there. What's probably the most common, cancer myths you hear, and, what would you kind of advise if someone was thinking, I shouldn't really be eating that food source, or I'm going to stop eating that? What would your advice be?
I think there's three that come to mind for me. I think one of the ones is that superfoods can prevent cancer, and often by superfoods, you'll see adverts for green tea and blueberries, and they can be a little bit more expensive, so especially if you're considering your budget. But what I would say is superfood is like a marketing term, so there isn't one particular particular food that is going to be a superfood. And it's looking at your diet as a whole. So for example, if you think of blueberries being a superfood, there's no benefit of eating blueberries versus eating any other type of fruit. So the main advice about if you're looking at disease prevention or healthy eating advice is about having lots of fruit and vegetables and as a minimum 5 portions a day, but that could come from any type of fruit. It doesn't have to be specifically blueberries. So it's just being aware of that, and I think it's looking at healthy eating in terms of a holistic approach. So diet is one part of it, but it's looking at lifestyle and body weight and reducing alcohol. So it's not looking specifically at one superfood, it's looking at your diet as a whole. I think a second one that comes to mind is a lot of patients ask me whether sugar feeds cancer and whether they should avoid sugar. And I think what you find is with a lot of myths is they take a little bit of science that might be correct.
So a seed of truth.
Yeah, and there's a little bit of truth and it makes it sound more plausible, and then people think, oh, actually that's correct. So sugar, for example, in your body, all of your tissues, including cancer, will feed off sugar, and particularly your brain, uses a lot of sugar for energy. But it's so much more complicated than sugar just feeds cancer. Because if we eat, for example, carbohydrates, they're broken down in the body to sugars, and if we have sugar, it can be further broken down. So your body would have simple sugars as an end product of digestion that tissues within your body would then feed off almost. So I think the theory of sugar feeding cancer comes a little bit from that. But you wouldn't be able to cut out all of the sugar from your diet.
And I think we evolve, we actively seek out. Is that where the kind of, I really need that chocolate bar? Is that sugar sort of?
And I think what I would see is that even if we cut out all of the sugar that we were eating, like chocolate bars and things such as that, your body would make sugar because your tissues sometimes need sugar to fuel from. I think if you're watching your weight, it is sensible to be mindful of the sugary things like reaching for a chocolate bar if you're concerned about gaining too much weight. But I think there's no specific evidence that sugar alone is going to feed cancer.
Is the whole sugar discussion as well, is that the basis of like the keto diet that we hear a lot about? And I've had a lot of patients ask about that.
Yeah, and I think what I would always say to patients is that there's not one diet that is going to cure cancer, and you've got to be so careful because I think a lot of these myths circulate online, and actually there is no magic answer.
There's no magic diet as well.
There's no magic diet, and a lot of these diets can actually cause more harm than good, and I think they can actually be very difficult to follow, and they can be very confusing for patients. So I would be very mindful. And the other one that I get asked a lot about is about acidic foods, and I've had patients ask about following an alkaline diet, and the theory with that is that if you have too many acidic foods, this is the theory, is that it would make the internal pH of the body too acidic, which is where cancer would thrive. So it promotes people to eat more alkaline foods, which would then, in the aim of making your blood more alkaline. But I think that again isn't evidence-based, it's not something we would recommend. And I think your body is really good at regulating things like your temperature, your pH. So actually what we eat doesn't really have a meaningful effect in the pH of our body, because our body is an expert at regulating that anyway. And so I would say anything that you hear that sounds too good to be true, just be really cautious. And websites, for example, like Macmillan, Cancer Research UK is fantastic. There's lots of information on there where all of the different myths for cancers they've got on the website, and it'll say whether it's evidence-based or whether it's not evidence-based. So it's a really good website for making informed choices, and I would say to patients that's a really good website to try and have a look at.
Can I just ask as well, because there's another one that I get quite often about, is detoxes, and it's funny how you talk about the alkaline diet and how our bodies are generally doing that anyway. Is that, sort of the basis of the detox diet, that our bodies are kind of detoxing all of the time?
Definitely, I think your body, your kidneys are working to detox and get rid of waste, and other parts of your body do that. So I think, your body is such a complex structure. It does do a lot of these things that you don't actually need to follow a specific detox diet or an alkaline diet. Your body is an expert at doing that anyway without us even realising that it's doing that.
I suppose a lot of people are making money out of, certain detox drinks that, you fast all day, but you'll be all right if you take a certain and drink, and again, this is, if something's sponsored or, there's a science behind it that's been sponsored and there's money in it, they're the ones, I suppose, to take a little bit with a pinch of salt and reference it with something, that, like Cancer Research UK, they've got some great stuff on their website.
Definitely, and I think you have to be so careful because, I've seen an article in the news this week about a celebrity endorsing treatments for coronavirus, which actually weren't evidence-based, and it's exactly the same for cancer treatments. You see either famous people promoting these really unevidenced diets that there's no evidence base for them, or like you see companies that are advertising products or supplements or certain diets that they may be making money from. So I would always check the evidence behind it. Cancer Research UK is fantastic. The other great source is the British Dietetic Association, and they've got some fantastic food facts and resources on there as well. And I think one thing I would promote is, with the role of a dietitian, is we only work with advice that is evidence-based. So the advice that you get from a dietitian, is factual, it's evidence-based, and it's correct. So I think dietitians in that respect are really good sources of expertise to be able to provide correct and factual advice.
So when patients are going through treatment, and they are getting a bit confused and, despondent that, a certain diet isn't working or something like that, would you sort of advocate that they go and maybe speak to their specialist nurse or their chemo nurse and they can, maybe get in touch with you? It doesn't take 2 minutes just to drop you an email, from the key worker to say, patients worried about this aspect. And is that part of your role to sort of help with those sort of things?
Yeah, and I think, at any point, if patients want the advice of a dietitian, they can get referred as well. I know at the moment with coronavirus, we're doing a lot of telephone consultations, so it doesn't have to be, if people are worried about that, it doesn't have to be face-to-face, but we can, definitely patients can get referred to the dietitian, for that advice, and any health professionals who want to ask questions to the dietitian can get in touch. It might be just a simple question that we can answer. That's absolutely not a problem.
And I think a couple of more things as well I just wanted to ask you, Emma, is, we've talked about myths and things like that as well, but we do hear a lot of things in the press, and most recently was the intake of red and processed meats. How much truth, we keep talking about these things that are discussed, how much truth is in some of the stuff that's been said about that?
Well, the World Cancer Research Fund, they've got a great website, and they've got a lot of the, it looks a lot of cancer prevention, but it's got a lot of the evidence behind the recommendations as well. And they recommend with red meat to have between 350 and 500 grams of red meat per week. So that would include things such as beef, lamb, pork, and then processed meat would be anything that's generally processed. So like things like sausages, ham, salami, anything such as that.
So, and is this sometimes the process to go through as well?
When it's processed, they can add a lot of chemicals to preserve it, so things like nitrates and other chemicals. So the advice is for red meat, which is just the lamb, the beef and the pork, is to have the 350 to 500 grams per week. With the processed meat, it's about having little or no processed meat. But I think it's balancing it out, because that would be a recommendation for cancer prevention, particularly for, it's mainly looking at like bowel and colorectal cancers. But I think it's getting a balance. I think if you're having treatment, it's about feeling safe still to eat some red meat. It's just having it in a balance, really.
And I think that's probably what the message that I feel like you're trying to get across, is that we shouldn't demonise any foods. Or cut any food sources out. Because even, something like a donut, although, we wouldn't recommend you eating one every day, it has its benefits. It does make you feel happy, and I think the more we kind of demonise these foods, I suppose the attitude towards our food is sometimes skewed a little bit.
Definitely, and I think it's about looking at what's a priority for that particular person at that particular time, because it might be that you're going through treatment and actually you don't really feel like eating much that particular week, and actually the priority is about eating well. So it might be about having a little bit more red meat and not worrying about, about the recommendation, if that's all that you really fancy and if that's a good way of getting your protein in. Or, if your appetite isn't great and you fancy a donut, then that's absolutely fine. So I think it's looking on an individual level and about what is priority, because often our advice and priorities for nutrition can change through the cancer journey, so it's about being adaptive as well.
So Emma, we've talked about a lot of myths there as well, and we've talked about protein. Obviously there's a lot of supplementation out there with regards to like protein supplements, and there's other things as well like multivitamins and things like that. What would your advice to be with somebody who's maybe recovering from cancer, who are maybe thinking about looking at a generic vitamin tablet?
I would be really careful. And as dietitians, what we would always recommend is that ideally you get your vitamins and your minerals from your regular diet, from food. And I think you have to be so careful because you'll see a lot of information on the internet promoting high dosage antioxidants and multivitamins. And often patients will think, that's really important during treatment or after treatment, but actually having high vitamin or mineral supplements can actually be harmful, particularly if you're having treatment. They can interact with a lot of drugs and with the treatment itself. So I would always advocate trying to get your micronutrients, so your vitamins and your minerals, trying to get that really from your food. And if you are considering starting any type of supplement, just check in with your oncologist before you do actually start anything. If you have a health condition or some sort of concern that means that you don't feel that you can get those nutrients in from your food, again you can ask to be referred to a dietitian so we can have a closer look at your diet and see how we could bridge that gap and try and meet your nutritional intake.
I think again, if somebody's maybe finished their cancer treatments, and they're not on any sort of active treatments, do you think there's maybe I suppose you've already answered the question, for like a multivitamin, but maybe if somebody doesn't really know where to start with their diet, is it still worth taking a multivitamin if you're not on active treatment?
The only supplement I would recommend would be vitamin D, because often there's periods in the year where we can't get enough vitamin D, and the advice is for the general population in those particular months to have a vitamin D supplement. But I would still always, even after treatment, advocate trying to get that from your diet. I did mention previously the British Dietetic Association. They've got, if you go on their website, they've got food facts, they've got brilliant resources on healthy eating on a budget, on practical tips to obtain a balanced diet so that you don't need to get necessarily supplements. So they're a fantastic resource to get the really quick downloadable information sheets that can be really useful.
And I suppose you're a Macmillan oncology dietitian, and again, just to reinforce there that Macmillan do an amazing job getting the best evidence-based sort of information out there, but they also do some amazing things like they do like a recipe book, which I've seen and read through, which looks at things like constipation and fatigue, and they give a sort of very basic recipe of how to kind of help with those sort of ailments.
Yeah, Macmillan, are absolutely amazing. I think the website has so much useful information, like you say, the recipe books. They have information for, again, eating healthy during cancer treatment. They have information for people that may find they've got particular eating problems during cancer and require, the high calorie, high protein advice. They've got so many different resources about coping with fatigue, different treatments, and I think it's a really valuable resource to use. They've got a telephone number that you can ring to ask questions. They've got community chat groups. So I would, definitely look at Macmillan. I think it's a fantastic charity and a fantastic website to go to.
And I think a lot of it comes down to, I suppose, we're all sort of educating ourselves about, what food provides what and what nutrients, if we're feeling a bit low mood or maybe fatigue, there's always a food source out there that could actually help. Like I say, it doesn't come out of a packet or, and it I suppose food, can change our mind, it can change our waistline, it can change, so many things. So, but for me, I try and find out as much as I can about all of these different things. But again, Emma is a great resource for patients out there to get that advice. And again, like I say, we've talked about different sources of information, but if you want to talk it with your chemotherapy nurse, and she's happy maybe to refer you on or ask for Emma and the team's advice in the dietetic service. But Emma, it's been great today, and I've really enjoyed, it's been really interesting talking to you today. Thank you very much for coming.
Thank you for having me.